No work. I'm very hot.
I want to be greasy on the camera.
Okay, try mine. AC, no. No. No.
I should have put on my makeup today so I could know how to smell all over my face.
Just so you know, this will be on ZNAS and
Good.
Try mine to all my Asian people. Ale Lakai. No AC, no work. No
Enough
AC,
is
no
enough.
work. Enough is enough. Enough is enough.
Say it again.
Not enough. No AC, no work. No AC, no work. Enough is enough. Too long. Enough is enough.
No AC, no work.
No AC, no work. No AC, no work.
Enough.
Enough is enough. Enough is enough. No AC, no work.
You know me, I mind you. That kind of I have just came back from vacation and I really thought that this air condition problem would have been resolved. But unfortunately, it is not. That is why we had to take this stand today, so we can let the persons who are in charge know that we cannot no longer work under these conditions. It don't make no sense if we are staff here coming and can't perform the duties because it is very hot and exhausting. Heat and work does not go good together. Thank you very much. We would love to have AC by the end of this week.
The day.
I give them the week because you may have to send it on the boat.
Nurses at Marsh Harbour Clinic is here under the mango tree protesting because of the heat. It's not that we don't want to work. We love our jobs. Nursing is a modest, tedious, hard job. And we need to be in a comfortable environment. Please, whoever is out there hearing us, we need an AC in the clinic. Please, we're begging you. We're not here to just be under the tree because we want to be under the tree, but we're here because we're frustrated, we're tired, we go home tired, the nurses go home sick from the bacteria in the molds in the roof, and we need help. Marsh Harbour Clinic needs nurses. We need help. Please send help. Thank you. I am one of the clerks that work in the hot cage where the windows cannot even open. We've been out of AC now for the past 8 weeks that I know of because I've been on vacation and come back to this hellhole again. I cannot take it anymore. I love my job, I love what I do, but I am not gonna trip on files anymore. It's time that somebody come and help us. I've had enough. Enough is enough. That's right.
Plus mold with no ventilation equals poor working conditions. We are tired of working in this situation. We need the air condition to be fixed immediately. Patients are coming in sick and becoming even worse. They come here to get help, but because of the situation, they're leaving even more sick. We need help. Please fix the air condition. 4 months, long enough. 2 months, long enough. 2 weeks, long enough.
General clinic, we have antenatals, and normally we do both clinics in the morning. This afternoon we have general clinic still going on from the morning clinic and family planning. So right now, because of the heat, it's frustrating the nurses, and when the patients come in, they're frustrating us because of the heat and everything. They want you to, you know, do it in a timely manner, but you can't do it in a timely manner if you're under heat because you have to keep the windows open. The fan ain't pushing as much as you would want it to do to push. So you're at the stage where you're frustrated and the patients are frustrated. So right now we're calling for help. For us to help the patient, we need help first. We have to first help ourselves. Okay?
So now you talk about family planning, so that means pregnant women having to be
antenatal is this morning. We have to turn away antenatal patients. Any emergencies, we have the doctors inside and we have the head nurse inside of any emergency. But at this time, we have to turn all the patients away. Any emergency or persons that we felt as if we prioritize, any persons that were in a position where we felt as if they needed to be seen. The doctors did all everything, and the head nurses.
Since last year, some of the mini split in the waiting area was burnt up, and it ain't been fixed since. That's probably why the other two air conditioners had to work so hard, because we used to have to keep the door open so the patients in the waiting area could get a little bit of AC. So I guess that worked the air conditioners extremely hard, which was a no good anyway.
And then you had to put the plastic around it to stop the mosquitoes.
That's right.
Because in the waiting area, the mosquitoes normally come in, and now at this time with dengue fever and stuff around, you don't want to be bitten by mosquitoes. But we had to put the plastic, thick plastic around the windows in the waiting area to avoid the heat, some of the heat and the mosquitoes. Because if you come in the morning time, early in the morning in emergencies, the mosquitoes greet you. You understand? And right now, in the case with dengue fever, mosquitoes normally bite in the mornings. Their normal time to bite is in the morning. So when we come on call, the nurses and the patients getting bitten by mosquitoes. So right now we at risk because of you having to leave the windows open or the plastic. We're trying to stop the mosquitoes isn't working. So right now we don't know what to do. We're working in a hazard place, and we right now we tired of that.
And you have had cases of dengue fever here?
Well, I don't. We had cases. We had cases of what? We had
dengue fever.
Of course. Yes.
Yeah.
We had a few. We didn't have a lot.
Yes. Yes. Numerous suspected cases.
Ready?
No. More than 10. Numerous suspected cases of dengue. I remember that. One time
I know from last year, when Dr. Hubert Minnis had come up, they promised that they were going to do renovations to the government clinic, from the ceiling to the painting, because at that time council had purchased paint for the outside of the buildings, and they asked us to hold off on it because the NIB board was coming up to do assessment of the government clinic. And here it is 8 months to a year later, and nothing has been done. The ACs are now broken down. The staff cannot work. They do not have the proper working conditions. Something has to be done. This is not a joke. You know, these are our nurses here that are on a sit out today to make a statement that the conditions out here at the government clinic are unacceptable. Do what you promised. Don't promise if you're not going to do it.
The bathroom is in there leaking, and it needs to be fixed. The water keeps coming down on the floor. I gotta keep drying up water. That causing my shoulder pain me, and the heat is hot and enough is enough. I can't hold out no longer.
The bathroom stall, that door still missing in the ladies' restroom?
The men's room they got do it. So they need to fix it. So I can't hold out that. That will kill me.